observed over the years that the obesity epidemic worsens the cardiovascular health and well-being. Now, concerning trends in obesity rates across racial ethnic groups over the past 4 decades, particularly a rising prevalence of class 3 obesity have stymied reductions in cardiovascular disease mortality. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be talking about how bariatric surgery reduces the new onset heart failure, myocardial infarction and mortality among the elderly population. In a recent study published in the Journal of American College of Cardiology, the researchers have found that bariatric surgery is linked with a lower risk of mortality and better cardiovascular outcomes. Now, previous cohort studies demonstrated that bariatric surgery is associated with lower all-cause mortality and a lower risk of incident major adverse cardiovascular events for patients with class 3 obesity. However, the long-term effect of bariatric surgery on the cardiovascular outcomes in the elderly population is not well studied. Therefore, a team of researchers evaluated the association between the bariatric surgery and the long-term cardiovascular outcomes. It was a propensity-matched cohort study where the major outcomes assessed were all-cause mortality, the new onset heart failure, myocardial infarction, and even ischemic stroke. The researchers found that the bariatric surgery was definitely associated with a lower risk of new onset heart failure, myocardial infarction, and even stroke. They noted that the benefit of bariatric surgery was evident in patients who were 65 years or older. Hence, it was concluded that among participants with obesity, bariatric surgery is associated with a lower all-cause mortality, new onset of heart failure, and myocardial infarction. These findings imply that there is not only clinical benefit of not only examining the cardiovascular outcomes among surgery patients, but it is also essential to identify the role of social determinants of health in disparate cardiovascular outcomes after bariatric surgery. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.